This is Amanda Kocher, and today I will be discussing cardiac output and how the autonomic nervous system influences our cardiac function. So let's start by defining cardiac output. So it is the volume of blood that is pumped out by each ventricle per minute from the heart. That is pumped out by the right ventricle and the left ventricle, which will become important later. Generally, it is relatively equal between ventricles. There are specific instances where it might be slightly off from equal, but for the most part, our cardiovascular system keeps that equal between the right and left ventricles. You can calculate the cardiac output for an individual by multiplying their stroke volume and their heart rate. One of the things that can affect cardiac output is whether the person is relaxed and calm or whether they're in a state of emergency, which we'll be talking about in depth here in a little bit with the autonomic influence piece. But the reason I bring that up now is because the cardiac reserve is essentially the amount of blood that can be ejected from the heart in a situation of emergency when the contraction strength of those cardiac myocytes is increased. And that varies the cardiac output in the case of an emergency, or it also could be in the case of exercise, especially strenuous exercise. So let's get into how our autonomic nervous system influences this process. So you have parasympathetic and sympathetic divisions of our nervous system that act on the SA and AV nodes of the heart. More so the SA nodes, specifically with parasympathetic, but they control the rate and strength of contraction of the heart muscle. Sympathetic nerves are also going to act specifically on the ventricles, and we'll talk about that in greater depth here shortly. And both are able to accomplish their influence by altering the activity of the cyclic AMP, second messenger pathway, which is what helps our pacemaker cells properly control the rhythm of our heart. So I have included a graph here to the right that just shows you in the red, we have the parasympathetic stimulation, which ultimately will decrease the heart rate. We have the blue, which will increase the heart rate. So now let's take a little deeper look into these graphs as well as into these concepts one by one. So parasympathetic stimulation tends to be our kind of rest and recover or rest and digest division of our autonomic nervous system. So again, the autonomic influence is something we don't have to think about. It's our more automatic or unconscious influence from our nervous system. But our parasympathetic nerve that acts on the SA nodes is the vagus nerve. And it acts on the heart by increasing the potassium permeability of the pacemaker cells. And if you remember, the pacemaker cells do not need nervous stimulation for every action potential. However, that depolarization, repolarization cycle of an action potential still has to happen. So in the case of a parasympathetic stimulation event, you're calm, you're resting, something along that lines, you're going to see an increase in that potassium permeability, which is going to ultimately decrease the rate of the action potential. So as that repolarization happens here and more potassium is able to move across the membrane, you're going to get a greater level of hyperpolarization here, which makes it take longer for that cell to drift back to this threshold potential, thereby slowing down your heart rate because we are slowing down the rate at which action potentials can fire. So that's our parasympathetic stimulation, which is actually going to, while it's stimulating, it is decreasing our heart rate overall. On the flip side of that, we have the sympathetic stimulation, which is our fight or flight, could be called fight or flee, but this is our stimulation in the case of an emergency or in the case of exercise. And the overall effect is that it is going to increase our heart rate. Okay, and in specific, we'll talk about how that happens kind of using our graphic in here. So with sympathetic stimulation, we are speeding the depolarization of our membrane to the threshold. So our depolarization here to threshold is much shorter than it would be in a typical, which is what our black dotted line is showing. It does this by increasing the sodium and calcium intake of the cell. Again, they are positive ions, so as you take those positive ions into the cell, you're going to get that membrane potential increasing toward the positive direction much more quickly. Once we hit threshold, then we are doing our normal action potential. Okay, as this comes back down though, as repolarization is happening, immediately we are again increasing that sodium and calcium influx into the cell and turning that corner basically to quickly return to threshold and fire another action potential. Ultimately, this will increase the heart rate because it increases how quickly our action potentials occur. In addition to acting on our pacemaker cells of the heart, the sympathetic nervous system also innervates contractile cells of the ventricles, which allows us to have an increased strength of contraction in those cases where we are needing to quickly get oxygenated blood around to our muscles so that we can either fight or run or exercise or whatever the state is requiring. So ultimately, the sympathetic nervous system acts on ventricular contraction. It decreases the time between action potentials, increases that force of contraction, and speeds up the relaxation process. And essentially, through all of those things combined, is able to eject more blood from the heart so that we can quickly escape a situation or have the necessary oxygen and nutrients in our muscles to complete whatever type of exercise we may be doing. So you might be wondering, okay, how does this affect me moving forward in life? One thing that we have found, and in a study done by May and colleagues, they've looked at maternal health and how maternal health in pregnant females is going to influence fetal development in terms of cardiac development and function. They propose that the fetus of an aerobically trained woman would show an increase in cardiac function and greater cardiac output than in those of a non-exercising woman, which is interesting when you think about what you're doing now may affect future offspring that you may have down the line. So in this study, they did a randomized study they started with just under 150 women that signed up for their study. However, through parameters, it was reduced to 133 women between the ages of 18 and 40 that were put into a randomized study where they were assigned to either do aerobic exercise or non-exercise for the duration from 13 to 16 weeks of pregnancy through 34 to 36 weeks, which is when our study concluded the collection phase of their data. So if they were in the exercise group, they were looking at 150 minutes of aerobic exercise per week. In the non-exercising group, because of the fact that previous studies had shown that being active during pregnancy is beneficial, these women were doing non-aerobic stretching type exercises rather than those aerobic exercises. But at 34 to 36 weeks, depending on gestational age at the time of data collection, fetal development was tracked with an ultrasound and an electrocardiogram was done on the fetus to look at that heart development and function. So ultimately they found a lot. So this is a general table of their findings. I tried to highlight the things that they said and that the p-values showed were significant. So what they found was that right ventricular stroke volume and right ventricular cardiac output both increased significantly with p-values that were extremely low. They also found that the pulmonary valve velocity time integral increased significantly. The aortic valve peak velocity increased significantly, and the pulmonary diameter increased significantly. The authors do note that the right ventricular cardiac function being more greatly influenced does make sense, as in fetal cardiac function, while still in utero, the right side of the heart is dominant in function. So ultimately what this study concluded was that 150 minutes of prenatal aerobic exercise does ultimately positively influence fetal cardiac development and function. And what does this tell us? What do we know? What do we need to know moving forward? So clinical implications of this study tell us that obstetrics providers should encourage prenatal exercise in women to improve their own cardiac function, but also to improve that of their fetus. And research implications include kind of some different directions, but ultimately, what are the long-term changes that we see in fetal development and then on into childhood and adulthood? And then also, does the type of exercise matter? Does it matter that it is strength training or resistance band training or purely body weight aerobic training? What are the best safe types of exercise for prenatal women to be carrying out during their pregnancy to help improve that cardiac function in their fetal development? Thank you so much.